Good. So I think we are live. Hello, everyone, and welcome to the second Sunstar conversation. Today, we will talk about the role of oral health in boosting sport performance. And we have the pleasure of welcome our guest, which is Professor Ian Needleman. He is actually very special because, of course, he's a specialist in gum health, but also he leads the Center for Oral Health and Sport Performance of University College London, and is also part of the International Olympic Committee UK Research Centre. So, of course, he has a lot of knowledge to share with us. So, welcome, Professor Needleman.
Marcia, thank you very much. Pleasure to be here.
So I think the best will be to start to know a little bit more why you decided to study this field.
Okay, well, first thing, like probably a lot of people listening in, sport is a passion, both competing and spectating. But as a practitioner in oral health and a researcher, what we've known for a long time is that oral health affects the rest of the body. The two things are connected, the head and the mouth are connected to the rest of the body. So there's a very direct connection. We've got lots of evidence. We've got lots of evidence, for instance, that gum health can interfere with diabetes. We've got lots of evidence that oral health can interfere with people's quality of life. So it seemed to us a really interesting idea, concept, to think, could oral health have an impact on elite sport performance, particularly knowing that at the elite level, the differences between, say, first a gold medal and missing out on a medal at all can be very small margins.
Okay. And also, during this chat, if you have any question, remember that you can ask a question through the webinar chat or through our Facebook channel, okay? Beside that, what I wanted to ask you is, when you think of the different impact of oral health in elite athletes, I think there are many different impacts that can happen. Could you talk a little bit about them?
Yeah, of course, pleasure. So the most obvious one that people may have seen news stories about is an athlete who has trauma, an accident, knocks out a tooth, or a very serious infection in their mouth, something like a wisdom tooth flares up, and that is sort of catastrophic, and it takes them out immediately of a competition, of training. So that's the most obvious one. There was quite a lot of information about that. We were more interested in more subtle effects of oral health. So when we've been researching since our first study, which was at the London 2012 Olympics. And what we found is that athletes at the elite level have poor oral health. In other words, high levels of tooth decay, of gum inflammation, gum disease, as well as erosion of their teeth, which is acidic erosion caused by acidic intakes and reflux from the stomach, and sometimes even disordered eating. And the evidence that we have suggests that there are physical effects, so that if you have pain, which not necessarily very severe pain, but ongoing levels of sensitivity, mild or moderate levels of pain, this will have an effect on you and your training and performance. If you have inflammation within your gums, irritation. So some people who are out there may recognize, for instance, that occasionally their gums bleed when they clean them. And that's typically a sign of irritation or inflammation. And that can get into the rest of the body and have an effect on health and have an effect on performance. And as well as those kind of physical, biological processes, there's also psychological or psychosocial impacts, where if one's oral health isn't so good, it will have an effect on appearance, and that affects confidence. We've got, again, lots of evidence from athletes using very careful research methods to find out that athletes will report that their gum bleeding, for instance, affects their confidence in how they can do things. their oral health is affecting their sleeping, their comfort with eating, which are all absolutely critical to an elite athlete, as they are to all of us, of course.
And when you talk about like tooth erosion, for example, could you give us some example of like food intake that can actually impact that?
Yeah, certainly. So it can be things which seem to be quite mild, but taken regularly over a long period of time. And anything which is acidic, which could be natural fruit juices, for instance. It could be carbonated drinks, because when you put the gas bubbles in, they dissolve and form a mild acid. It could be some of the sports drinks, some of which are also acidic. And it could be, as I've mentioned, sometimes people have reflux from the stomach, which is quite acidic into the mouth. So all of these things can cause erosion. At any one time, the amount of wearing away of the tooth will be very small, but over a long period of time, particularly if it's repeated, will have quite an effect so that the enamel is lost. Typically, people might notice the teeth looking a bit yellow because it's the white enamel which is very visible. And then once the teeth start to look yellow, it's because the underlying tooth structure, which is called dentine, starts to show through.
Oh, okay. And like usually how do you approach the elite athlete in terms of like, do you train them somehow on this topic? Do you run any program on this?
Yeah, so what we've recently published is a study to examine how can we change lifestyle behavior in elite athletes. And we ran this in 2 Olympic teams in the UK and also a professional rugby team. And before we started the study, we tried to work out, well, why should they change? And we asked them, we did some questions to find out what would motivate athletes to change. And you probably wouldn't be surprised, Marcia, to hear that actually the oral health wasn't the biggest motivator. What we found was much bigger motivator was that the oral health could have an effect on performance. So an understanding that poor oral health would have an effect on their performance was extremely motivating. And in fact, when we evaluated the study afterwards, the factor which 93% of athletes said was the most motivating one was to avoid inflammation or irritation in the rest of their body coming from the mouth. So we use those kinds of messages to explain that oral health was important. And then we did these messaging to the whole team, to the athletes, but also to the coaching staff, to the performance directors, to the nutritionists, to the physiotherapists. So everybody understood the same message. And then we gave the athletes themselves an examination, assessment to find out how their health was, and some really very simple things to do, which could fit in. And again, this is also important, that could fit in with their daily routine. So, and these things will be very familiar to people listening in, I think. So brushing their teeth twice a day, but the enhancement for performance was to use a high fluoride toothpaste. And that's something which in many countries isn't routinely available in the shops. You have to get it from your dentist. And I mean, they're the well-known products, and those high fluoride toothpastes are really good when you have people who are at higher risk of problems. So twice a day with that fluoride, cleaning between the teeth at least once a day and before toothbrushing. And cleaning between the teeth is a really good way of getting rid of the inflammation within the mouth. And also, very importantly, having a checkup with a dentist twice a year. And for athletes particularly, having at least one of those checkups in the pre-season period. So if there was any treatment that needed to be done, it could be done before serious training resumed.
And did you observe like a real improvement with like the athletes that you follow while they're like improving their oral health routine? I mean, what type of improvement did you saw?
Well, we were absolutely delighted. And it was a short study. It was start to finish for each of the athletes 4 months. And I think the first thing to say is that almost everyone that started the study finished it, which is unusual actually. So there was really good buy-in. They felt this is something they could do. And in terms of the key measure, those that were reporting an effect on their performance dropped dramatically. So we were saying that the biggest motivator was to improve performance or to avoid the effect. And that's in fact what we found through, from the beginning to the end of the study. The self-reported effects on performance dropped quite dramatically.
Oh, okay. And what do you think is really the key? I mean, to get the people motivated, because I think this is basically the trigger. I mean, beside the fact that I'm sure that also the people that are joining us today by doing sports, maybe they're interested in see how to improve in their performance. Maybe they're preparing for the next marathon. Maybe they're, or those Spartan series that are really interesting lately. What do you think it could be like the real trigger to make sure that a good oral health is incorporated also during the day?
Yeah, it's a great question, Marcia. So for me, I invest a lot of time and effort and thinking about preparing for a competition. It's really important. And for me, and I think probably a lot of people listening in will recognize this, you want to get to the start line feeling you've done everything you can. And that gives you that confidence of knowing, well, you've done everything, you've done it as best as you can. And most of us who are not elite athletes, of course, we never have the time to do everything we want, but you try and do as much as you can. I think with the oral health elements here, we're talking about very simple things, which are actually very easy to introduce or to do it during a normal day. But just having that part of your routine, when you get to that start line, knowing that you've done those things as well, gives you that additional confidence. So as well as those kind of physical effects, just knowing that you've done everything you can is really powerful as a motivator.
And are you aware of programs that are run for the wider population around this topic and that leverage the interest in sport performance, for example, in your country or in other countries?
I think there's very little that's being done at the moment for the general population. We certainly try and communicate these messages through social media and publications, but I think it's a really important area to get to, and particularly to get to youth sport, because by the time we get to the elite athletes, who are typically 18 to 25 years old, some of the damage has already been done, and much of that could so simply have been avoided. Plus, it's the youth sport is the kids in the youth sport. It's such a great time to have to instill good behaviours, which can then last a lifetime.
So, hoping that the Olympic Games will happen next year. I mean, are you still collaborating with the medical team for preparing and help elite athletes to be 100% ready for the competition?
Yeah, we are indeed. So we're involved with the GB squad in the lead up to Tokyo 2020. Like you, and the athletes particularly, we desperately hope it will go ahead and it will be a very successful games. And we hope that the oral health component there will also be very well received and will achieve some good outcomes.
And like thinking of your latest research, since I assume that you're still really focusing on this topic, do you have like a latest information to share?
So one of the areas that we've been looking at is the bacteria in the mouth, because it's everybody around the world is getting very interested in the bacteria in the mouth, as we're all very interested in the gut bacteria, the microbiome, this whole collection of the bacteria in the gut. And what we're understanding is a lot more about the mouth as well. So we've been looking at that. We've got some interesting studies, some interesting data already looking at how athletes, how the bacteria in the mouth, how stable or unstable it is over a period of time, but also how similar, but also how different athletes are to non-athlete populations. And that could be really interesting in terms of performance enhancement. We already know, for instance, that there's a very well-known sports supplement called beetroot juice. It's very concentrated beetroot. And it seems surprising now, it seemed surprising then, but it's a recognized supplement. And if you're doing medium length in endurance activity, and you train with these beetroot juice supplements, it can improve your performance. So why I'm saying this is because the reason that works, it's absolutely dependent on the bacteria in your mouth to start off the process which leads to those performance benefits. So we have a very good example at the moment of how oral health can contribute to performance benefits. And an understanding of the bacteria in the mouth and the microbiome means, can we also think about some very simple things like nutrition? What is it that might benefit an athlete in their normal nutrition that might help them to have a better type of bacteria in their mouths, let alone the oral hygiene elements of removing the bacteria. So that's something which interests us a lot at the moment.
It's really fascinating. So basically what you're saying is that the bacteria in our mouth can impact at the end not only our health, but also our performance somehow.
Exactly right, Nadia. Very well put.
And basically, just to understand if I got it correctly, would you say that athlete has a specific series of bacteria, like a specific, let's call it team of bacteria that help them perform better? Or do you think is like a more linked to every single person has a different tailored set of bacteria that live with them?
It's really early days to say. There is already some research reports which suggest that there may be some athletes or some profiles of bacteria in the mouth which are more associated with better performance. We're unsure about that. It may be that the differences that we're seeing and others have seen also is particularly related to an athlete's nutrition, in particular the type of carbohydrate intakes and protein intakes. So what that suggests is if you can change the ecology, the composition of the bacteria in your mouth in a positive way, it would be good to do that through good eating and healthy eating as opposed to taking supplements. And that could be achievable, that should be achievable for everyone.
And basically like mouth and gut microbiome, so the pool of bacteria that are there, are they connected or?
Yeah, again, you ask very good questions. Yes, of course, and without doubt they're connected. And that's again part of the research that we're looking at is what is the association and how can we use one to perhaps predict what the other might look like? Because it's obviously much easier to sample and to measure the bacteria in the mouth than it is in the rest of the gut.
But you were mentioning beetroot juice. So why is that like boosting performance? It's bizarre.
Okay, so, because beetroot is one of the vegetables that is naturally very high in nitrate. But you have to drink a lot of beetroot juice to get the performance benefit. So what's happened is at least one company, and there's a company in the UK that has produced concentrated shots of beetroot, which is really very small bottles which you can take, a lot easier than sort of taking half a litre of beetroot juice at a time. And it's that concentrated beetroot. But we also know that the nitrates that are found in beetroot are found in lots of other leafy vegetables. So it keeps coming back to whereas we're talking about a sports supplement with a beetroot juice shot, well, actually we're talking about in terms of population health and the general population is having a good diet which includes this wide variety of vegetables, particularly even more than fruits. And if you have those vegetables which are high in nitrates, there do seem to be important health benefits particularly in relation to blood pressure, in fact.
It's very, it's very interesting. It's amazing how everything is interconnected.
Yeah, absolutely.
Yeah, and just one thing before continuing, for the people that just joined us, I just want to remind that today we're talking about the link between oral health and sport performance. Of course, if you have any question, you can ask them via our webinar chat in Zoom or in Facebook in the comments. And yeah, so I will move on a little bit and asking you, beside what you just said, what do you think could be the top tip to share with our audience today?
Okay, so first thing is that physical activity, sport is good. Yeah, so there's a risk that when we talk about elite athletes having poor oral health, it might seem that what we're even suggesting is that sport is not good for you. That's not the case. It's good. So please don't misunderstand me on that one. Secondly, if you spend a significant amount of time preparing for sport, training for sport, it may well be that you're at higher risk of oral problems than other people. But it's not inevitable. It doesn't mean you have to have those problems. So first of all, just accept that you may be at higher risk and do something about it. And the first thing I would suggest is see your dentist on a regular basis and explain to your dentist what you do in terms of sport, in what kind of training you do, what's your nutrition like. And for instance, what I ask athletes to do, and my non-athlete patients as well, is to fill out a diet diary. So over 3 days, typically at least one of those days being a weekend, to write down everything that you eat and drink during the day, by the time of day that you have it, how much you have, so that you can take that along to your dentist, and it will be really helpful to analyze, is your diet increasing your risk of oral health problems? And also your dentist increasingly will be able to give you general nutritional advice as well. So think of your dentist as somebody that can be your oral health coach, as opposed to somebody that just fixes your teeth, and build that kind of relationship. And the more information you give a coach, the better the information and guidance you'll get back from them. So build that relationship, and as I say, see them if you're serious about sport at least twice a year. Yes, Marzia, please.
Yeah, I was actually, I think you said something extremely important, because I think often we think of our dentist just, for the annual or biannual checkup.
Yeah.
And just to keep our smile bright. In reality, it's true that a dentist can be a health coach. Yeah. Given the big evidence that have been coming out in the last 20 years about the link between oral health and general health, being more proactive and let's say ensure a good exchange with our dentist regularly, I think can help a lot, improve from different angles. Sport is one, but of course there are many others that can be considered. And this is actually why we decided also to start those Sansa conversation, to help people think more healthy.
Yes.
And think and include the mouth in it. Because at the end of the day, everything passes through the mouth. Is the entry point of so many things. And so it's important to really consider it as a whole. And yeah, I just wanted to say that I really, I agree with you that the dentist can be really a health coach to take into consideration.
Yeah, and use your coach as much as you can. Give them plenty of information and ask for coaching, so tips. So many of us, most people brush their teeth at least once a day. A lot of people brush twice a day, but it's quite difficult to do it really well. And even if we do it really well, in one time in the year, in another year or two, we may just have lost the technique a little bit. So ask your dentist or hygienist for coaching on how to make it even better, how to improve your performance with the toothbrushing, and also getting in between the teeth, particularly if you've got space to use those little brushes which go in between the teeth, or dental floss if you don't. And those, again, that's just the techniques. Without instruction and coaching, most people find they're really difficult and just give up because they're so difficult. But with coaching, actually, you very quickly get the hang of it, and you'll notice the difference in terms of how your mouth feels. And Marzi was just talking about how important it is for health. But again, if we can bring it back to the quality of life and the confidence, it's really important to think how oral health can just contribute to our well-being, and just making us feel, yeah, look good, mouth feels good, no bad odors, all these kinds of things, which are really important for well-being.
Sure. I have actually something that is very curious to me is when you think of athletes, elite athletes, do you reckon that there is like periodontal disease or halitosis, this type of problem that are like more prominent compared to the normal population?
So in our studies, we found similar levels of significant gum disease. So gum disease where people are losing bone around the teeth, that's what we really think about as gum disease, which can lead to people losing teeth. And we find similar levels to those that are quoted from population surveys in the UK. So you might say that there's no difference. In fact, I would say that the fact that they are similar is quite telling. In fact, they should be better, because these are people whose general lifestyle is better. So the fact that the levels of gum disease are actually the same suggests they're actually a bit disadvantaged. What we find is the tooth decay is certainly worse than the population. And to give you an example, for gum disease, we're finding in these young individuals, 18 to 25 years of age, about 20 to 25% of them already have quite significant gum disease, meaning that they've lost bone. And the problem with that is you can't get it back again. It's irreversible. It's a good question you ask, and it's a really important one. And the other thing to say about this type of gum disease is it's very preventable if it's not only picked up at an early stage, but the right kind of behaviors are started at a younger age.
Okay, thank you. Actually, I can really hear a question about how could I know that my bacteria in the mouth are the good combination? It's a difficult one.
Yeah.
How do you know that?
It is. So currently there's no way of so remember, the public just finding that out very easily. What we've done, of course, is these so-called microbiome studies, where we take all the bacteria, we look at the genetic material and find out, these several hundred species of bacteria, and find out these kinds of fingerprints. So there's no way of knowing that in a very tight way, but as a member of the public, one way that you'd have a good indication of that is if you don't have bleeding when you clean, and in particular, if you go to your dentist and ask them, do I have any signs of inflammation or irritation from my gum health? Because sometimes if we don't see bleeding, it might be because actually we're not just getting in there deep enough with our cleaning. But your dentist will be a really good person to give you that kind of screening and feedback.
All right, thank you. Another question that we have here is about the Olympic Games. Basically, they're asking if having the dentist in the medical team is something normal, or is it just in UK?
So actually, at the Olympic Games, there's a big dental clinic. We were involved in London 2012. The clinic there was the second busiest medical service within the Olympic Games. The only thing that was busier than dental was physiotherapy. So we had 7 dental surgeries running from 7 in the morning to 11 o'clock at night fully booked throughout the whole duration of the games. So incredibly busy. So that's something that the International Olympic Committee pride themselves in providing fantastic level of care, which is free not only to the athletes, but also to the coaching staff as well. In terms of national teams, it's very, very variable. Some countries have embraced this, but I would say they are few in number. In most countries, it's up to the athletes themselves to maintain their own oral health and to find their own dentists.
Okay, thank you. And I have the last question that comes up, that is basically they're saying oral bacteria can even play a role in lowering blood pressure right after exercising by converting nitrate to nitrite. Do you know about it, and could you comment on that?
Yes, Marcia. So that comes back to the beetroot juice story that I was telling earlier. So the bacteria in the mouth are the ones that are responsible with starting this conversion of nitrate, which is in the beetroot juice or in beetroot or in some leafy vegetables as well. And that is associated with lowering blood pressure. Yes, so that's quite correct.
Thank you. So I think for today we arrived to the end of our conversation. I would like to thank you for your time, and for also I would like to thank everybody that attended the session. I hope that you learn some useful tips to boost your performance and to think more of oral health as a part of your general health. Remember that you can ask a question either by sending an email or also by commenting on Facebook. Also, if you have like a certain burning topic that you would like us to discuss, we're happy to receive your comments. The next SANSA conversation will be on the 22nd of July about quality of life. That, of course, is also linked with what we discussed today with Professor Ian Needleman. And of course, on behalf of SANSTAR, I thank again our guest speaker and all of you for attending. And I wish all of you a great rest of the day.
Thank you.
Thanks.